Hi, everybody. Today we're here with Dr. Khan and Dr. Khazaie. They're both at the Mayo Clinic. They received an EndoFound grant in 2019, and they're here today to discuss with us their research. So Dr. Khazaie and Dr. Khan, I'm going to ask you to introduce yourselves and tell us a bit about your work. So Dr. Khazaie, maybe you can go first.
Yes, I'm a professor of immunology at Mayo Clinic in Rochester, Minnesota. My work really is mainly dealing with control of inflammation. And this is in the situations where the inflammation is chronic. I do a lot of work on cancer, tumor-associated inflammation, also on immune surveillance. So that is basically how the immune system recognizes something foreign and tries to protect us against that. That includes tumor or endometriotic lesions.
Great. Dr. Khan, would you like to introduce yourself?
Absolutely. My name is Zaraq Khan, and I'm a reproductive endocrinology and infertility, as well as a minimally invasive GYN surgery specialist at the Mayo Clinic. My special interest especially is in surgical approaches to endometriosis and then dealing with endometriosis associated infertility, which is my primary thesis or line of research work. And during training, we worked a lot in sort of Dr. Khazaie's world of basic sciences. I usually sort of joke with him and I say we make a great pair because you're the brains and I'm just the mouth of the program because we just do the work. And Dr. Khazaie thinks about all the smart things that the disease responds to, and how does the human body basically fight against foreign diseases, or how does endometriosis trick the human body into staying in a place where it shouldn't be, is basically the questions we're trying to ask with such research projects.
Wonderful. So it sounds like the perfect duo. Could you tell us a bit about what inspired both of you to conduct research on endometriosis?
Sure. I guess my part was when we were in training in infertility, we usually have to choose a line of research or an area of disease of specialty. Because of what I do, which is primarily reproductive surgery, and endometriosis is actually affecting about 10% of the population, causes significant pain and a lot of disease burden. And even though we say it's a benign disease, there's nothing benign about it. I truly mean that even from a surgical perspective, because the surgery for the disease is exceedingly difficult, and sometimes as bad as cancer surgery, with the tissue planes and how stuck things are with scar tissue. And that's why one of my focuses was to really do this niche practice of advanced endometriosis surgery, which requires fairly a long training, but then later on providing that service and pairing with personnel or with colleagues like Dr. Khazaie in the basic sciences lab, and trying to put our heads together to say, how do we're managing this disease a certain way right now with surgery and with aggressive form of invasive therapy. But there's got to be a way, if we can figure out how the disease starts, and if we can somehow find out how this normal tissue that is supposed to be in the lining of the uterus goes into an abnormal location in the pelvis and becomes stronger and becomes smarter and changes the way it acts and changes the molecular signature. If we could understand those pathways, that would be the key, because we could switch those on or off. And even though I deal with the disease at the tail end of its presentation, with partnership with Dr. Khazaie and his lab, we're trying to figure out how do we get ahead of the disease before it even gets to the point where I see it as a surgeon.
Right, great. So really getting to it at the time that's critical.
And that true what we call bench to bedside translation of a research or of a disease process is something that's very, very exciting to me as I guess a born nerd, but it makes it exceedingly interesting to sort of study it. But I think the additional advantage that comes to it as a human on the human level is when you see your patients in clinic and you see what they go through on an every single day basis. And pain being something that's abstract, that you can't quantify, becomes very difficult to understand. And a lot of these women are not even heard because they feel like they're not heard because they truly aren't. They're complaining of pain and they're often told this is in your head, and really sort of catering to that group of patients that haven't been heard ever before, and just listening to them and listening to their symptoms and then doing their surgery and seeing the differences and what a huge impact one can make, makes that disease almost that much more interesting. So my trainees always know, I always say about endometriosis, I love endometriosis and I hate endometriosis at the same time, if you understand what I mean.
Yeah, totally. And Dr. Khazaie, what about you? What inspired your work on endometriosis?
You know, I have a background of research in cancer metastasis. I've done work on breast cancer metastasis, and that was before I discovered immunology and became an immunologist. So when Dr. Khan and Dr. Daftari introduced me to endometriosis, and I knew very little about that disease at the time, I became really fascinated with it. This is basically a metastatic disease, but it's not cancer. So in cancer, the metastatic lesions start eating up the tissue that they land in. And it becomes a very complex disease because you have tissue destruction, you have a massive suppression of the immune system so that the immune system cannot attack the tumor. Endometriosis lacks those things, but it metastasizes. It spreads and goes to distant organs. So it's very interesting from both point of view of genetics. How does it metastasize? You know, it's a normal tissue in principle, it's not a tumor. And then how does it impact the immune system? You would have thought that it does not impact the immune system as badly as a tumor. Therefore, there must be better hope for immune control and immune therapy of endometriosis, which has not yet been seriously considered. So I thought from those 2 points of view, it's a very fascinating disease.
Great. And I'd like to move on to the grant that EndoFound provided you in 2019 and the project that was awarded that grant. So it's up to you two who would like to discuss this first. Could you just tell us a bit about that project?
First of all, both from Dr. Khazaie and myself, we would really like to thank the Endometriosis Foundation. The Endo Foundation grant was something that really kept our idea afloat. And for those that are in the line of work that do research and understand how hard it is to fund these projects, really would appreciate and know exactly what I'm talking about when you're at that point when you're barely breathing and somebody comes and rescues. So we're obviously indebted and grateful to the wonderful support that we've been getting from your foundation as well to continue our project. The project started as a dream when I was in training, and we looked at a transcriptional factor. I'm just going to make it simple and say it's basically what determines how DNA signature is read in cells. And there's certain things that can be turned on or off by the influence of the environment. So genetics is what we get from mom and dad. Epigenetics is what the environment sort of adds to our DNA or to our signature. And we were looking at certain mechanisms of how scar tissue sets in disease processes like endometriosis. And can there be certain ways where we can target certain mechanisms in how scar tissue sets in and reverse them with medications? And so we worked with a mouse model, we did several different endometriosis creation surgeries in mice for first targeting the disease process and then reversing it with pharmacologic mechanisms. And then we further led on to looking at if there was scar tissue, what kind of cells were there in scar tissue, and what kind of an immune response the body had to that scar tissue. And that's where Dr. Khazaie's lab and his expertise sort of worked with our project, and we've continued to blossom that relationship.
Great. And Dr. Khazaie, do you have anything to add?
So I entered this point, this project at the point when Zaraq had finished his laboratory work and had gone into surgery. So I was pretty much of a novice. I inherited the animal model from Dr. Khan and Dr. Daftari. And what we, so this animal model is a mouse model. Obviously, mice don't get endometriosis. So this was an experimentally induced endometriosis. It's involves surgery where uterine horns are removed and implanted into the peritoneum. In this model, we followed up their observations that indeed with a mutation that they had discovered in endometriosis patients, and also basically created a mouse model based on that mutation, we could produce lesions that were made a lot of scar tissue, and we wanted to understand how this scar tissue is formed and what's the genetic basis of it. We have done over 100 surgeries now in mice, and we basically wait for 3 weeks, and then we euthanize the mice and take the tissues out, and we study them. The question was, where does the scarring start? Is this a reaction of the organ in which the endometriosis lesion lands in, or does it come with the endometriotic lesion? At least in the mouse model, I can say that most of the scarring was from the endometriotic lesion itself. And I think this could vary in human endometriosis depending on the type of endometriosis. In this case, the graft was in humans where the invasion is in the colon. I think the scarring, a lot of the scarring is in the colon itself. So there's a great need to take into account how we are modeling the disease in mice. So in the mouse, the scarring was in the tissue that that came and was implanted. And we also made an observation which initially very much complicated our research, because the mice we were studying were outbred. Outbred means that, so we, as immunologists, we like to work with inbred mice. These are basically like brothers and sisters. They have identical genetics and the identical immunity. But the mouse model that Dr. Khan and Dr. Daftari had initiated were outbred, kind of like humans. And then we decided to do good immunology, we have to make them inbred. So we started crossing them brother and sister, and so to make them immunologically and genetically uniform. And we realized that the scarring was becoming less and less. And this prompted us to think what's going on. So we intentionally introduced different genes to be expressed in the implanted tissue, and we realized that the scarring goes up. So that was actually, I think, quite an important discovery, because when you have a foreign gene being expressed in the implanted tissue, that happens a lot in cancer, because there are a lot of mutations which happen and that produce foreign, if you like, bodies in the tumor. It also happens in endometriotic lesions, because endometriotic lesions, although they're much more normal than tumors, they do have mutations. So that tells us that it's not enough to have these mutations that they discovered. These mutations have to go hand in hand with certain types of immune responses against the lesions. So I think this was quite exciting for us. So we think that the scarring is a combination of the inherent mutations of the lesions and the type of immune responses that you get against the lesions. And what we also did, we did molecular analysis, and basically what we term RNA sequencing. So you look at all the genes which are expressed in the lesion. And that was quite eye-opening as well, because the gene that Dr. Khan and Dr. Daftari had discovered are in a pathway which is called the TGF-beta signaling pathway, but it wasn't quite known exactly what this mutation does in that pathway. The TGF-beta pathway is quite a maverick, because it can control inflammation, or if it's combined with other expressed genes, it can promote inflammation. And we found that actually the genes which are expressed in the lesions are a combination of anti-inflammatory and pro-inflammatory, which kind of makes sense because the scarring is a response at the end of inflammation. So when inflammation wants to be is being shut down, at the end there's a lot of tissue repair, and that tissue repair involves scarring. So that was also very interesting. And this really puts us in a very good position now to go into humans and study specimens from humans. And we can address all these questions now in human tissues. And we've actually started doing some pilot studies in this direction.
Great, that's wonderful to hear. And right now, where are you with the project? I mean, I know with recently what's happening in the world, it's been difficult to access labs and continue with research. Could you tell us a bit about that?
Yes, we have nearly completed the project. We still have, so what I explained to you, we have defined the source of the scarring. We have defined the gene expression that is responsible for it, and what we would really like to characterize more is the type of immune responses. And so we still have to do some, if you like, stainings to see what kind of immune cells infiltrate these lesions. We're actually doing that in parallel with mice and humans. And Zaraq can explain more. We have actually got put together a big investigators at Mayo Clinic to do this in prospective clinical study.
Oh, wonderful, great. So maybe Dr. Khan, you can answer this. What is the impact of this research for patient care? What are the implications for patient care?
Yeah, that's an excellent question. So as a translational scientist and mostly a clinician, one of my questions always is, basic sciences is amazing because that's the foundation of our knowledge. But most studies that I like to look at and that I'm interested in are in what makes the most impact into a clinical arena. And just by understanding the basic molecular signature of the disease, the impact could be tremendous, starting from therapeutics, targeting pathways if you stop certain pathways from the beginning, the expression nip it in the bud would truly be translated. There could be other different mechanisms where we could understand the disease better. As a clinician, and Khash knows this, we usually talk about things like, why does the garden variety endometriosis only affect the pelvic lining, whereas there are certain endometriosis then misbehaves and starts invading the bowel or the rectum, or it goes inside the ovary or adjacent organs? So what changes in that basic molecular signature of the disease that it starts to invade surrounding tissues? And just by understanding these basic pathways of what happens to the disease and how our immune response sort of interplays with it, we would be in a better position in targeting those, and even possibly in the future genotyping disease processes and explaining prognosis to patients. Right now our pathologists are just looking at the disease and saying, yep, this is endometriosis, it was involving X, Y, and Z. But if we can understand more what we need to learn from the disease, what the disease is saying to us, because there's everything talks, there speaks in the body, there's an interplay, beautiful interplay of a conversation. And if we can understand what it's saying to us, or the signal that it's giving us, we can probably understand the disease and give better prognoses to patients in recurrence rates or aggressiveness of the disease. Right now, what we're doing is we're taking the disease, taking it as one big phenomenon and treating it as one big endometriosis. Whereas in my opinion, this is a very, very complex disease where, and there's several different variations of the spectrum.
Right. So it sounds like, the research is not just going to give answers to scientists like yourselves, but also to patients who are actually, I think, looking for these answers. I mean, we know from our patient community that that's very important.
Absolutely, and that's the goal, and that's why it's so important for, you know, collaborations like this. I look at the Zoom meeting and I truly, you know, it brings a smile to my face because I see the Endo Foundation, a basic scientist, and a surgeon sort of talking about the disease, and that's what's important. That, you know, building those bridges, and that's, it sounds sort of cliche, really, to be honest, but I think that is how you beat these, you know, these truly tricky diseases, or start talking about them at least. I mean, we have examples of, you know, look at breast cancer, how far they've come, and that's fantastic. That's you know, that's an example for medicine for all of us.
Yeah, agreed. And we really value these collaborations. So thank you so much. Yeah, so moving on, I think what excites both of you about research on endo, about the research that you're doing on endo? So Dr. Khan, would you like to start?
Sure. It's a fairly loaded question, right? You could speak for a very long time regarding that, but I think I would echo what Khash has been talking about. I mean, really the exciting prospect of really trying to sort of, what I usually make an example of this is like peeling the layers of the onion, right? And we're trying to get to the core of it, or the plot keeps getting thicker, but if you like sort of the drama of the mystery and still know that it will still have an impact and your work will continue to have an impact, I think that's just what keeps at least me personally going, and really trying to just keep at it. And there's so much exciting things like organoids that Khash was talking about, trying to now grow these culture systems outside of the human body. That's going to open a completely new arena of research for us. And while the disease may be tricky, I think there's just some fantastic people working on it from various different areas. And that's what's exciting, to sort of be a cheerleader for your other colleagues, for yourself, and for your patients, and that's what makes it fun, and it makes it fun.
Yeah, definitely. And Dr. Khazaie, what about you?
Yeah, you know, I've been for over 30 years working in the field of cancer, and it's a very complex disease. And now I have been confronted with a disease which will open a window to me that I would have never opened if I had just focused on cancer. I'm hoping that my experience will benefit patients with endometriosis, because I'm putting my bets on the fact that in many ways, as complex as this disease is, it's much simpler than cancer. And many of the things people have been doing in controlling tumors may work much better here. That gives me a feeling of satisfaction, because I feel that I will be able to help patients who are suffering, but it will also satisfy my curiosity about what happens in cancer. And I can look at it in a much simpler way. So I'm very excited about it.
Yeah, and I think we're happy to hear that, the hopeful message you gave. So that sounds good. I also realized that, you know, with all this excitement, there comes many challenges to the research that you're conducting. So could you talk a bit about those challenges specifically related to endometriosis research?
Talking to experts, and we do that all the time. I mean, this has to be a teamwork. Is the big discussion is what exactly is the cell type that moves away from the original tissue and goes, let's say, into the bowels? Does this cell type change form as it's doing this journey? So there are, for example, big discussions as to whether the cells that disseminate are the secretory epithelium, or they are fibroblasts, or there's a cell type that changes between these two. These are really challenging questions, because you have to catch the culprit in the act. We may be able to answer it through the genetics. And that's why the work that Dr. Khan and Dr. Dr have done is so important. So I believe this is going to be the most challenging part of this work. But then this is exactly the same question people are asking about cancer metastasis. So it's going to really benefit both fields.
Yes. And Dr. Khan, what about you?
I mean, I would echo that, but I would sort of give it a spin and see what my challenges are from the clinical perspective, right? I mean, I think that my challenges as a clinician is really, you know, doing that 9-10 hour surgery, massive debulking, and you're trying to do the best job you can with a minimally invasive procedure, and the patient doing great, and then 2 or 3 years later, symptoms coming back, you know. That's a huge setback for the patient, but as a surgeon and a provider, I usually, you know, tell my patients there's a big burden that we share as providers for the patient primarily. And I think that those are some challenges that we're still continuing to fight on the clinical side of things. And that is why these collaborations are so important. That is why understanding the disease and the molecular sort of level of the disease is going to be so important, because I think it's definitely going to translate into the end suffering, which is the patient, and that's what it's all about. That's really what it comes down to.
Yeah, no, exactly. And in terms of the so there are all these challenges that, you know, we're facing. So in terms of overcoming those, what do you feel needs to be done in terms of future research?
I think what it needs to be done is to apply basic research to human patients.
Mm-hmm.
And we are ready to do that. And there are already labs which are doing this. It does need the kind of collaboration which we have set up here between people who spend all their time on the bench and people who spend most of their time doing surgeries. So I think that's the way to move forward, in order to be able to take the discoveries from the bench into the clinic.
I absolutely agree. I think one of our biggest shortcomings is, you know, like Dr. Khazaie mentioned, mice don't get endometriosis. And, you know, and if you're going to be studying mice or other animal models, that's completely different from humans. And really that translation work will start once we start getting these human trials going. And the exciting thing is that it's started to happen, and it's happening all over, which is great. But we're exceedingly excited about that at Mayo with our team as well. And that would be our next steps moving forward.
Yeah, so I think there is light at the end of the tunnel. It sounds hopeful. And I think that a few messages that I'm getting from both of you is, one, these collaborations are really important, like the one that you have made together. So, you know, I think that is wonderful, and I thank you both for it. And not only just the two of you, but like you said, Dr. Khan, with like nonprofits like us, like EndoFound. So, you know, we at EndoFound are very appreciative of the work you're doing. It's wonderful to hear that, you know, the grant has had such a large impact. And I think the other thing that I've, you know, really heard today is how the research in the lab and, you know, that basic scientific research has such a translational impact all the way down to patient care. You know, that's why it's so important to fund these projects. And with
Absolutely.
that, I wanna ask you, do you have any final thoughts or comments that you'd like to share with us?
No, I think you hit that on the head, the nail on the head there. I echo your thoughts, and I again, you know, thank you guys for your support, and always appreciate of our collaborative team at Mayo, and we hope to continue doing the work that we're doing.
Thank
you very much.
Yes, I also completely agree with both of you. Yeah.
Thanks.
Okay.
Thank you.
Thank you. I think that's the way to move forward, in order to be able to take the discoveries from the bench into the clinic.
I absolutely agree. I think one of our biggest shortcomings is, you know, like Dr. Khazaie mentioned, mice don't get endometriosis. And, you know, and if you're going to be studying mice or other animal models, that's completely different from humans. And really that translation work will start once we start getting these human trials going. the exciting thing is that it's started to happen, and it's happening all over, which is great. But we're exceedingly excited about that at Mayo with our team as well. That would be our next steps moving forward.
Yeah, so I think there is light at the end of the tunnel. It sounds hopeful. And I think that a few messages that I'm getting from both of you is, one, these collaborations are really important, like the one that you have made together. So, I think that is wonderful, and I thank you both for it. And not only just the two of you, but like you said, Dr. Khan, with like nonprofits like us, like EndoFound. So, we at EndoFound are very appreciative of the work you're doing. It's wonderful to hear that, the grant has had such a large impact. And I think the other thing that I've, really heard today is how the research in the lab and, that basic scientific research has such a translational impact all the way down to patient care. That's why it's so important to fund these projects. And with
Absolutely.
that, I wanna ask you, do you have any final thoughts or comments that you'd like to share with us?
No, I think you hit that on the head, the nail on the head there. I echo your thoughts, and I again, thank you guys for your support, and always appreciate of our collaborative team at Mayo, and we hope to continue doing the work that we're doing.
Thank
you very much.
Yes, I also completely agree with both of you. Yeah.
Thanks.
Thank you.
Thank you.